Hi, this is Dr. Mollie Marti, and welcome to Resiliency Matters. This is where we take the big resiliency research and best practices and break it down into small bite-sized pieces that we can begin using immediately to strengthen ourselves and others. What if you could learn from a member of a care team in Switzerland who has spent more than a decade responding to traumatic events? Would you spend the next 28 minutes with us? What if in the next 10 minutes you could learn how a community can work with first responders to increase and take care of mental health needs? Would you hang out with us? Who is us? My other half today is Jacqueline Koeninger. Jacqueline comes to us from Switzerland. She works for a national transplant organization where she educates about organ donation and seeks to increase the number of donors. She also is a longstanding member of the care team of the Canton of Bern. Welcome to America. Welcome to Resiliency Matters.
Welcome.
So what is the care team of the Canton of Bern?
The care team was founded in 1999 after a tragic accident while a canyon was flooded after a thunderstorm, and 20 young people died. These were tourists from all over the world, and the canton wasn't able to organize enough psychological support for all these family members and friends who came to Switzerland to farewell to their loved ones. So the care team has 180 collaborators, and we were active in 394 cases in 2014.
That's amazing. Started because they saw a need, and now it's grown to such a profound support in Switzerland. Yeah. So who does the care team help?
The care team helps everyone included or involved in a tragic event, like victims, survivors, relatives, eyewitnesses, anyone who needs help, we help.
Okay. And your focus is on the short term, kind of the acute care, right? Tell us more.
Yes, our goal is to support people who suffered a traumatic event until they are able to act on their own again. That means that they know who they can call, or that they have friends or family to support them. We try to do that with the SAFER model. It's a model in 5 steps. If more professional help is needed, we will help to find it. But our organization will never provide long-term support to one people.
Okay. And I was intrigued when we were visiting the other day about the SAFER model, and I jotted down these steps, and it is stabilize, acknowledge, facilitate, encourage, recovery, and referral. And so that is a psychological model that you learn, and then you provide consistent support based on that model.
That's exact, yeah.
Okay.
This is exact.
So what is your relationship with what we call first responders? You call them blue light teams. I find that endearing. But you have a very close working relationship with these first responder teams. Tell us about that.
Yes, for us it's very important to have networking, like we call that the blue lights. These are the ambulances, the firemen, and police. They can, when there's an accident, they can call us when they see that there are people who need help. So they call us, and we'll go there and see what we can do, whom we can help, and what kind of help is needed in this accident. So it's the first responders who call us to come.
And you said they're very welcoming and relieved because you come in and they get to go home because they focus on the physical, and you come in and you support that social, emotional well-being.
Yes, they're very glad that we exist because we can do a lot of their work when their work is done, so we can take care of the people. And when the care team didn't exist 10 years or 12 years ago, they had to they stayed with these people, and so they're glad we can do something of their work too.
What a powerful partnership. Yeah. So from your understanding, how is the care team structured with paid staff, volunteers? What does that look like?
There are about 10 people who will be in charge in case of a catastrophe or an accident for the whole year. The rest of the team will have at least 1 week on guard per year. That means that we have to be in the office from 8 to 5, and then we can go home, but we're still on guard for the rest of the night. We can also be called when an emergency happens close to where we live. We get paid for the week on guard, and when we are called for an emergency, we get paid. It's not
a volunteer position.
Yeah.
So your first 2 weeks of training, which we're going to talk more about that, is volunteer, and then as you become a member of the team, you're paid for your services.
That's right, yes.
And you are an RN, a registered nurse. What type of professions do you see in your volunteers or your team members?
Basically, anyone can apply to become a member of the care team. So I see any type of people who work in an office or like nurses, but any kind of profession is welcome to be a member of the care team. So
you're bringing a variety of experience,
yes,
which is
that's true. Yeah, that's important for us.
It is. So here is your tool for segment number 1, a community benefits when first responders are backed up by second responders focused on psychological well-being. What community resources can you help organize or get involved with? The number 1 most important factor in providing psychological first aid, stay tuned. Hi, I'm Dr. Mollie Marti, and welcome back to Resiliency Matters. We are visiting with Jacqueline Koeninger from Switzerland about the care team. How does one apply to become a member? We've been talking about who are the members, but how do you even apply?
Yes, basically anyone can apply to become a member of the care team. There are tests once a year where applicants have to prove that they are capable. You have to do role plays or a lot of conversations. In the end of the day, they decide if you belong to the care team or not. If you have to take a test.
So they want to ensure that you're strong, that you have the proper skills, that you can do the work, and they're testing you on that. Okay.
Yes.
When I was looking at some of the background information, I came across these kind of founding principles of psychological first aid, and I would like to just share them with our viewers, and we prepared some things where you can kind of follow along. I find these really helpful, especially if you are having your wheels turning about what this might look like in your community. So it says that respect for human dignity is paramount. After a grueling event, everyone should receive psychological support tailored to their needs, regardless of gender, age, nationality, or religion. Children are protected by assistance appropriate to their age. They direct psychological first aid toward factors that support health and well-being. They don't focus on disease, but on wellness. And people should return as quickly as possible to autonomy in their daily life. these principles continue. AID aims to remind people that they are responsible for themselves. Psychological aid is provided in interfaith ways in cooperation with first responders. Workers are skilled and abide by rules of conduct and professional ethics, and aid is never used for recruitment or of patients or members of groups or churches. So out of all of these principles, Jacqueline, what one speak to you from your work in the field? What is just essential?
I think the first one, respect for human dignity, is paramount. It's, for me, the most important thing, that everyone is treated equal. So either if you have a victim, or if there's an eyewitness, or even if it's a murderer you have to take care of, you should treat him equal. Yeah.
And so I want to reiterate that, because it takes a bit to sink in. And so you can go on a scene and there's a drunk driver that has just killed a family, and you tend to that drunk driver if that's where the first responders send you. Or you have an active shooter and you might be assigned to care for the shooter. So you say that when human dignity is paramount, you truly mean that you meet anyone where they are and you care for them best that you can.
We try to, yes. That's important for us. Yeah.
That's profound. I find that very profound and essential to this work, if it truly is, the work that it is on paper and you're carrying it out in the field. So we talked about your initial basic training, and I think that was 10 days, a couple weeks of training.
Yes.
What does that basic training look like?
We spend a lot of time in this training to exercise this safer model we talked about. Like we have a lot of self-reflections in this training, and conversation is a big point, role plays, but we try to make workshops and practice this safer model a lot of this time.
So that when you go in the field, it's you know the steps,
yeah.
you know the protocol.
Yes,
yeah,
that's important.
And then you have ongoing training, and you said that's very drill-based, skill-based as well. So can you share one of your most recent trainings or drills?
Yes, a few years ago we had a big exercise of all these first responders. They all, we had to close a 20-mile tunnel in Switzerland, a train tunnel, and there were a lot of, because this train caught fire and there were a lot of people sitting in this train, they had to be evacuated. And from the firemen, from the police and the ambulance and the care team, there were observers everywhere. And so they looked how we reacted in this panic situation. Where people came out of this tunnel, a lot of them were injured, so they made a triage at the end of the tunnel, and they told us, so these people you have to take care of. And there were a lot of people with many different belongings, so one of these guys, he always told us, oh, my computer is still in the tunnel, I have to get this computer, but he was in a shock situation, so he didn't know what he was talking about, but he wanted to go back into the tunnel. And there were other family members were separated, they couldn't find their children or their parents, and yeah, that was a big exercise on where we could see how it's in a catastrophe, what it would look like. And after a few weeks, after these exercises, we got a feedback, and we took point for point what we could do better in next same situation. Yeah.
And we in Iowa and in many parts of America are getting a visual of that, even a 20-mile tunnel running through the Swiss Alps. And so you're talking about even two different governing organizations or bodies on each end of that tunnel.
Yes, yeah, the one end is in the canton of Bern and the other end of this tunnel is in the canton of Valais. So there were, on both ends of this tunnel were ambulances and police, and firemen. So yeah, it was a big deal to cooperate with two different cantons, and yeah, it was a good experience how it could be in a real situation. Yeah.
Well, the National Resilience Institute is a big proponent of drills, and what a great example that is for us and for the people. Like I said, I think there's a lot of viewers with their wheels turning right now. I know mine certainly are. So here's your takeaway, tip number 2. The most important principle in psychological first aid is simple yet profound: respect for human dignity regardless of circumstances. We are going to hear more stories from Jacqueline about trauma response when we come back. Stay tuned. Hi, this is Dr. Mollie Marti, and welcome back to Resiliency Matters. Today we are talking with Jacqueline Koeninger from Switzerland. Jacqueline is part of a Swiss care team. I call it the Swiss care team. It's actually the care team of the Canton Bern. And that's an important point because some of the cantons of Switzerland, equivalent to our states, our regions, have care teams and others do not. What happens if there is a big accident or a catastrophe in another canton? Can they come knocking on your door? Has that happened?
It did, yes. 2 years ago, there was a big accident in the canton of Valais with a bus driving in a wall in a tunnel, and there were about 45 children who spent their vacation in Switzerland were in this bus, and a lot of them died in this accident. So the canton was not able to handle this situation. So they called the care team of the canton of Bern, and we offered our help to support them in this situation. So we went, a few people from us went to the canton of Valais, and we helped where we could there in this accident. Yeah.
And again, that's a jump in American minds, because, and I've been to Switzerland a few times to visit you and see that, but many of your incidences can be international, the way that Europeans travel and come to Switzerland and ski from around the world. So it had that flavor to that as well, that these can be international incidences.
Sure, yeah. A lot of them are, yes. Yeah.
And so I know you have many, many stories. What is one of the most memorable calls? You said that during the year, let me back up 1 minute, during the year you serve 1 week where you're in the office daily, you're on call at night.
Yes.
And then, so something came in during that time and you went out on a call. What's one of the stories that comes to mind?
Yes. What I always remember is when we were called in the French-speaking part of our canton, and there was a young lady who went to her work in the morning, and she had a heart attack, and their colleagues, they tried to help her. They started to make CPR, but she died. And we were called, and we came maybe 1 hour later when the husband was already in the office, and their colleagues, they were in a shock situation. So one of us took care of all their colleagues, and one of us went with the husband. He had to get his 2 children, one His son was 8 years old. He had to go to school and get him out of school. And his daughter, he was 11 years old. He went for a week of skiing in the mountains. The same morning, we had to organize all these to get her back to where they live. And we went home with him and organized everything. And then he told us that he has to inform the mother of this young lady, but she also has heart problems. So we drove him to this place where the mother of his wife lived, and we had to inform her. But we stayed with him, and we tried to support him, but it was a very deep experience I made for myself, because my children are the same age, and it was a situation. Every day happens things like this, but it went very close.
Right, it hit you deeply, deeply. And it was close to home, we say. And these things do happen every day. That's part of why I'm so thrilled to have you on this show, is so people that are watching can think about, well, what is the care that we extend to others in our community during these daily traumas? You know, certainly we have the tragic accidents, but the losses, and how can we better organize around that? So when you go on site, you have this brochure in several languages, and it kind of sets forth some basic principles. Can you walk through that?
Yes, there are some informations who should help people, because maybe they're still in a kind of shock when we're leaving, so that it's all written down. They can read it, and they can write in the telephone, the numbers they have to call, because a lot of them just can't remember a number they did several times before, but they can't remember in this situation. So they can write it down, and there's some psychological, physical and emotional and behavioral aspects, like that they don't have, maybe there's some, they can sweat, or they have headaches after this accident, or they can't concentrate themselves, they can't sleep, they have nightmares, and in the end, after 5 or 6 weeks, these symptoms didn't get less, that they have to look for professional help.
So this is such a powerful one sheet, and the NRI has tools like this on the website to share out as well, to say, okay, this is normal, so don't get too upset about it. There is a grief curve and a response curve. You might need more help if this is still looking this way, and then what do you need to do now? So this is your takeaway. Essential post-crisis treatment includes education about normal responses to trauma and when additional support might be needed. It includes tips for self-care and clarity about next best steps. We're so grateful to Jacqueline to be with us today. Thank you so much, and thank you for joining me and Jacqueline on Resiliency Matters on MediaCom MC22, your local programming leader.